I think a lot of investors invest in biotech without necessarily understanding the risk. They see, the big pops. They tend to forget about the big drops, right? Everyone touts the time they got the multi-bagger, the 5-bagger. They don't talk about the time they lost 75% of their investment in a company that had one drug that failed, which could be a case with a stock like Geron. You see these big pipelines. The big pipelines aren't always quality, and investors aren't attracted to the big pharma companies that have huge pipelines, because any one drug isn't really going to move the needle that much for one of those companies. It's sort of tough to pick winners and losers, but if you look at the data and you see where it stacks up versus other drugs in its class, how it would perform, take a look, see what people say about management too, because usually there's a lot of questionable management with a lot of these micro-cap biotechs that seem to come out of nowhere. It's good to search around, see what their history is, what companies they've been at before. And then you just really need to compare the clinical data. Don't get excited over phase 1 compounds. Phase 2 compounds, take a look at that efficacy data, but know that it likely won't hold up in a phase 3 trial. So if it's borderline in phase 2, it's probably just going to get worse in phase 3. You really want to see great numbers coming out of phase 2, and be careful. This is something Geron's doing too in that non-small cell lung cancer. They're sort of mining through the data, trying to find a subset of patients that the drug worked on, and maybe advancing through that subset. When you start looking, for maybe this one population with left-handed patients with blue eyes, it had a moderate effect on. That's really a risky way to run a phase 3 trial, and we saw something like that with Eterna Zentaris and Keryx Pharmaceuticals. They had a cancer drug, Parafosine, that they advanced from a questionable phase 2 trial based on a subset that outperformed the overall population into phase 3. And it didn't work. The stocks were decimated. Keryx has actually bounced back because of the only other drug they had in their pipeline, Zeranex, but Eterna Zentaris has really just been, pounded ever since then, and it's been a terrible place for investors to put their money. So a lot of risk in biotech investing. Proceed with caution, and don't always believe the hype, and be skeptical, and do a lot of research and invest cautiously.